So yes, my name is, now that you've actually seen my face and I'm talking, hello. My name is Maggie Ansell. I use Margaret on the forms, but it is really Maggie, I promise. And I'm the Nursing and Consumer Health Liaison Librarian at the University of Florida Health Science Center Libraries. Today, we're going to be talking about how health intersects with technology and what role libraries can play to help support patrons as they utilize technology to manage their health. So I will say that today's webinar is particularly well timed because in addition to October being Health Literacy Month, it's also National Cybersecurity Awareness Month. So we'll definitely be going over privacy and security aspects of using technology for health purposes. That's one of the major sort of unique things about sort of health and technology is that sort of greater need to understand exactly where your data is going and what people are doing with it. So first, I wanted to give a quick outline of what we'll be going over in the next 45 or so minutes. I'd like to leave time for questions. First, we'll have a quick refresher on health literacy. I know we had a webinar on that, like literally, I think it was exactly a year ago, but just a real quick refresher on that. And then as we'll have an overview of technology and how libraries generally support access to and use of technology and sort of where the conversation is heading as far as where libraries and technology intersect. And then we'll spend most of our time actually talking about the application of different technologies to health, including mobile applications, social media, and then patient portals, telemedicine, that kind of thing. And then we're going to talk a little bit about the various ways in which libraries can support patrons as they use these various technologies. So before we begin, I will let you know that I do have the chat open, so you're welcome to make comments at any time and be all like, oh, hey, wait, pause, I have questions. This is super chatty and informal, so feel free to just like live your life. We're just gonna have some fun today. So getting started with health literacy, quick little review in case you weren't familiar. Of course, I have to share this quote. It is the quote everyone shares. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. This was part of Healthy People 2010. It's been used in so many different documents. It is sort of the standard definition. Yeah, it's used by all sorts of variations, but there are variations of this that acknowledge how health literacy encompasses a multitude of skills. So for example, there's literacy, there's cultural competency, there's numeracy, and there's even just the physical navigation of the healthcare system. If you've ever been in a hospital, it's quite a maze. As well as critical thinking. So health literacy is just sort of a constellation of literacies. It's just one part of it. There's a lot of elements to it. So there's whole dissertations about how we define health literacy. Is it a functional concept or just a theoretical concept? I ain't going into that. I'm basically just talking about it in the capacity of like, can you engage and manage your health is the way we're thinking about it today. And then just describing the fact that if you don't have health literacy or if you have low or limited health literacy, it's not a great thing. There are some pretty bad effects to it. You might have increased hospital admissions. You might be more likely to go to a hospital. You might be more likely after you leave to the hospital to have to go back. That's readmissions. Or you might have to stay longer for whatever reason. So they've actually associated having limited health literacy with spending more time in the hospital. You're more likely to have a chronic condition or to use the emergency room more often instead of, say, like a primary care provider. And then there's just also increased mortality, which is no good. Folks with limited literacy also don't use don't use primary care providers like preventative services. So like annual checkups, things like that. It's harder for them to manage the chronic illnesses that they're more likely to have. So like diabetes and things like that. And then they just generally have worse health in the sense that their health outcomes are not as good. And then they're have a harder time following the doctor's instructions. So that increases the chances that they'll have not as great health outcomes. And so that's why we care, is that it's not this esoteric thing. It actually challenges and makes it more difficult to sort of navigate the world and to live a healthy life. And so there's all sorts of economic reasons as well. People with limited health literacy are also more likely to spend a lot more money on healthcare, which is not great. So there's lots of reasons why we should care about this. And so when it comes to how we in the library interact or may come across folks who have limited health literacy, you might actually see this a lot with patrons who are asking health questions. There are certain kind of signs to look for. So if you've got people who are asking health questions and maybe doesn't really know how to phrase their question, or if they mispronounce disease names or medical terms, that might be a challenge, or a sign that they might have challenges navigating health information. If they're using sort of slang or informal terms, they can't use sort of like, things like otolaryngology, don't exactly trip off the tongue. A lot of times they'll seem like, I understand you. I totally understand you. I'm not totally confused at all, because there's this inherent shame a lot of folks have with like being confused, which is unfortunate. Or they won't ask any questions at all. They'll just sit kind of like a bump on the log, and they'll just not really engage. Or when they do engage, they're kind of asking questions that don't really match what you've been telling them or trying to tour them through. So it's kind of confusing. Like, why are you asking this question? It's because they're not really following you. Or if you're like, say they ask for diabetes information and then you find a book on diabetes and you give it to them, or if you find a pamphlet or some online resource and you give it to them, and then they're like, oh, I'll read this later, or I forgot my glasses, or things like that, that will end up, that's often a sign that they're going to probably go and try and find someone who can explain it to them, or they just don't want to say, hey, I don't understand this. And then if you're trying to ask like, hey, you said you had a question about your medications, I'm happy to like show you to our drug resources that we have, but they can't actually say what their medications are, which like, I can't even say what medications I'm on because they all have terrible names and they're very complicated. But if they can't even maybe like talk about the common names. So for example, maybe they can't say epinephrine, they can say prednisone, for example, or something like that. And yes, like Mary Kate says in the chat, like there's a big overlap between people who just have typical sort of limited literacy in general, like they aren't able to read, and they have limited health literacy. You need literacy in order to have health literacy. Or if they have vision problems, that could also be a problem. If things are in too small of a print, then what's the point of even giving them to a patron if they can't actually even read it from a physical standpoint? So there's a lot of different factors in play, but these are different kind of signs that we can point to. So these are just a reminder. You may have seen this from our last presentation on health literacy last year, but wanted to give folks that sort of reminder. So while health literacy is definitely sort of this giant constellation of skills and abilities, like you need to be able to read, you need to be able to see well enough to read, you need to be able to understand numbers if you're talking about prescriptions. There's all these different things. Today, we're going to focus a little bit more on sort of the technological skills that are needed as part of health literacy. So we're going to talk about tech literacy, or digital literacy as it's more commonly called, although I couldn't resist the like A to T, but that's just me. So the tech literacy elements of health literacy, because they're all sort of mishmashed together. So basically the big question, of course, is like, well, why tech literacy? Why are the libraries involved in this? What is going on here? So to answer that question, I'm going to use one of my favorite library advocacy resources, the Libraries Transform campaign. It's sponsored by the American Library Association. I love it. I love all of the posters and materials. I think they're so cool. It's a couple of years old now, but I can't get over how much I love this campaign. If you scroll through the giant Libraries Transform website, you'll see they have all of these different posters with these different because statements. And you'll notice that actually the majority of the statements that relate to technology actually focus on access to technology, specifically internet access. And you can see that here in these statements. Why technology? Because 5 million students can't access broadband at home, because the internet shouldn't have a slow lane, because you have to get online to be able to learn online. So it's this idea that libraries are a key resource for providing access to the internet or to computers in general. That is a role that libraries play. And that's totally common. It's very common for libraries to provide access to internet connected computers, and it's becoming even more common for libraries to offer circulating Wi-Fi hotspots so that patrons can bring the internet home with them. That's a pretty standard service that a lot of libraries provide. And while this is an extremely important role for libraries, it's also not the only one that libraries have with regards to technology. And so this last banner represents an important and sometimes underappreciated role for libraries, which is not only giving patrons access to technology or to the internet, but teaching them how to use it well, how to navigate the nuances and complexities of the information environment that technology provides access to. So to kind of get more into this whole idea of tech literacy or digital literacy and not just tech access, let's go to another definition. I love these definitions. And so this one is from the Office for Information Technology Policy. Digital literacy is the ability to use information and communication technologies to find, understand, evaluate, create, and communicate digital information, an ability that requires both cognitive and technical skills. And so I think this is really a great quote because it demonstrates that learning how to use and navigate technology is not an end in itself. You don't learn how to drive a car just to drive a car. You learn how to drive a car or use an oven or navigate the internet because you need to go places, cook things, and find, understand, evaluate, create, and communicate digital information. So I really want to emphasize that technology skills themselves are secondary in purpose. Their main job is to allow patrons to do other things. And so today we're going to be talking about how technology is an information tool that can be used to navigate health. So that's kind of how we think about it is technology, not an end in itself. Technology is simply a tool that allows us a lot of times, especially when it comes to computer or internet related technologies, navigate information, and today specifically health information. Okay, but before I get to that, everyone on the same page? We're doing good? Because I just threw 1,000 definitions and background information, so I just making sure everyone's okay. Ooh. All right, you can always pop up in the chat. I'm here. So these are two examples of the kinds of online training and that many libraries provide. So for the first is a website created by the Public Library Association. It's digitallearn.org, and I'm going to be typing that in the chat. So just 1 second while I do some chat typing. So the two are digital literary assessment and digital learn. The links are backwards, but that's what they are. And the local libraries can actually customize digitallearn.org if they talk to the Public Library Association, because that's the association that made this website. They can actually customize it with their own specific branding. And it's also available in Spanish, and who doesn't love that? So that's a cool thing. And then the second one is North Star, which is a state-run program that promotes digital literacy through assessing and training in computer skills. So you can see here that they offer very kind of basic, like how to get started using a computer, The North Star offers this test that you can test your digital literacy. And so there are, and these are just two generic ones, like Alachua County Library District, which is the library district that I'm part of, or that I'm a patron of, I should say, uses North Star as our sort of like the link that we send people to for gaining tech literacy skills. But anybody, there's 1,000 ones out there. You can obviously use lynda.com or LinkedIn Learning, I guess maybe it's its new name. There's all sorts of continuing education resources related to getting tech skills. In fact, wonderful organizations such as the Tampa Bay Library Consortium or the Northeast Florida Library Information Network or PLAN or any of the other wonderful acronyms, they all provide professional development and training like this, which we love. But now I wanted to ask the question, see if I can get it to work. What technology-related services, resources, and programs are you offering at your libraries? Feel free to pipe up in the chat or unmute yourself if you'd like to share, because I think this is a great way to think about what are you already currently doing, and how can and be keeping that in our minds as we think about how that can interact or relate to health in some way. So I'm just going to pause and be silent for a second.
Maggie, this is Mary Kate. While we're waiting for questions, for digital learn or digital literacy, is there the ability to add a section on getting familiar with health resources, or is it just standalone, basic computer? Because I saw in the where was email, websites types of. But do you think there may be the opportunity to add not necessary, because each organization, health organization, provides their own source. You can't get one to do all the same. They're not all like.
Right. Well, and that's why I think is what's really great about the Public Library Association is they do allow you to customize it. So I'll have to find the link because there's a different link that is the Public Library Association sort of page about the Digital Learn website. And then they actually have examples of different customized, none were based in Florida. Otherwise I would have used that as an example, sadly. But and so I'm assuming that when you contact the Public Library Association and ask to have it like custom branded for your website, that there is a certain amount of customization that can occur. So I don't know if they can add additional modules unless you provide the content for them, because the basic site itself is very, very, very basic. Computer skills, email skills, that kind of thing. But if you had your own modules that you wanted to incorporate into the sort of the basic framework of the Digital Learn site, I don't see why not. That's kind of the whole point of why they allow, or why they ask, they say, hey, if you want to make this custom to your own library website, like we can help you with that. And so I don't see why you can't do that. But I don't think that they actually provide more specific training. Yeah, these are very basic, very beginner level of just how to use a mouse, how to use a computer, like how to navigate file folders, things like that. But if your own library had more advanced trainings or recordings of trainings that you offered, I don't see why you couldn't incorporate it. So, but yeah, anyone have any? Sorry, I can't word today. Examples or suggestions of ways in which your libraries are working with technology services in any way, providing technology training? If it just feels like you want to sit quietly, that's cool too. But I definitely want you to be keeping the stuff that your library currently does in mind, because a lot of the things I'm about to talk about can honestly just be incorporated to the digital literacy and sort of computer skills services you're already providing. This doesn't have to be this entirely new program of, oh, now we've got to do this health tech literacy thing. It can be incorporated in a few simple ways. I'm going to kind of walk through it. So Technology and health. Huzzah. We are here at the part where we talk about exactly how we combine these two concepts. So there are a ton of mobile health applications out there, of just basically apps that have some kind of health related focus. These are just a few examples of different health apps that we actually recommend in our mobile health library guide. So this is actually specifically the patient education page of the mobile health guide that my colleague Ariel created. It's the mobile health guide as a whole is actually sort of more, just like our patrons, we're focusing more on health providers. So there's all the other pages in that guide talk about things like reference book texts and like if you're a doctor or public health apps. So it's meant for health professionals, but that one page does talk about patient education. And these are just a few example apps that I wanted to use. So obviously a lot of folks have heard of Couch to 5K. It's typical sort of 8-week running program. It's very good for beginners who are on the couch. That's the whole point of it. Clue is a period and cycle-related health tracker. It has a health encyclopedia for issues related to menstrual cycles. Milestone tracker is for pediatric milestones. It's from the CDC. It can track from 2 months to 5 years. You can put your little baby in and then it will track their basic developmental milestones. Because, you always have parents who are worried, like, is my kid slow? Is they behind? Are they behind? The CDC has an app for that. And it's also available in Spanish, which I love. There's also things like MyFitnessPal. This one has, it's most famous because MyFitnessPal has like the really, really large library of foods. So it's like even like packaged foods, it makes it really easy to find the nutritional information for pretty much anything you're eating. So if you're doing any kind of food tracking, it's a really handy resource. And then there's 7 Cups, which is basically a mental health app. It's not official counseling. That's a big distinction that a lot of these apps will have to make for liability reasons, which is they are not providing healthcare. They are not providing healthcare. They will tell you many times they are not providing healthcare, because if they in any way presume to provide healthcare, they are like legally liable in all sorts of scary ways. So you'll see a lot of disclaimers on a lot of these apps for that reason. So yeah, so 7 Cups is basically a place where you can talk to trained listeners. So it's not quite like a suicide hotline type of thing, but it's a little less of an emergency, but it's somebody who you can just sort of talk to and feel heard by. And that's another free one. And then Solar Clock is just a solar circadian rhythm oriented alarm clock for people who feel like they need to follow their body's circadian rhythms. So you can see there's all sorts of variety. I just tried to choose a selection of different topics, but there are all kinds of health related apps, from ones that are like only a little bit health, like Solar Clock is mostly an alarm clock, but it kind of has a health aspect to it insofar as it's like circadian rhythms exist. But to ones that are much more sort of like medical, like the milestone tracker, it's made by the CDC. It's much more like clearly from a medical source. And so I think where the library's role in this is in a couple of different ways. The library's role can exist in recommending mobile health apps, because for, all of these nice, 6 examples of what I would consider, good or trustworthy health apps out there, there's 1,000 more really sketchy ones that you don't know what they're doing with their data. Are they based in science? It's really kind of concerning. So the libraries can provide the role of sort of acting as the vetting process, and then also even teaching patrons skills for vetting. How to vet and how to kind of assess the trustworthiness of a mobile health app. And so I'm going to actually do that as kind of a little example. So let me I have more things I have to paste into the chat for you. So we're going to actually do a little live tour together I'm using Clue, the period and cycle tracker, as my example, because that one was a good example. And so give me 1 second and I will click on this. I have to actually do some screen share changing. So if you want to follow along, the link is in the chat. And here is what it looks like. So this is, and the thing is, I will say I'm doing this through Google Play's website. And so that we're going to explore the Android version. And honestly, I will say it's a lot easier to look at this information through the website than to try and do so kind of on your phone. It's a little bit harder. So thankfully, most apps, all of the apps available through Google Play and through the iPhone store, generally you can see that same information in a web version. You could just Google the name of the app, and then you can see this like the same exact information. So I could look up this exact same information on my phone, but I like being able to see all the menu options. So there's a couple of things to kind of be mindful of and to be keeping an eye on. Number one is who made this app? Who did it? And so this case, you can see it's by BioWink. And so you could look, if you scroll, you can see this is the developer ID, and I can open up a new tab and I can see learn more. Like, okay, this is the BioWink. It looks like they haven't made any other apps. This is the only app they have. So that's good insofar as they have an area of specialty. And then if you click read more, you can see all sorts of, they always want to advertise how great, look, it's the Obstetrics and Gynecology Journal says that it's the top free period tracker app. That's pretty good. It's that's an actual scholarly journal. And things like that. It talks a little bit more about the app, but where you get really more information about things is go all the way to the bottom to the additional information section. It always hides at the bottom. I know it's like a pain in the butt. And that's where you get to see things like it's, offered by, this is BioWink, and you can see visit the website. So you can actually see who is this developer. And you can learn more about the company that's behind this, and they can kind of talk about, you can do the same thing you do with a lot of consumer health evaluation. So I've taught a lot about how to evaluate consumer health websites. And that basically involves going to the very bottom, always going to the very bottom and being like, about Clue, let's learn about who these people are and whether or not they're trustworthy and things like that. Like, who's this organization and things like that. So that's really important to kind of know this. So here we can see that the people who are behind Clue, which is BioWink, this seems to be the main thing they do. That's the main thing they do. And so on the one hand, that's good because it means that that's their specialty. So if you see a lot of different apps that are for very different health specialties coming from the same author, you might be a little bit concerned because you're like, well, how do they know about all of these different health specialties? And then the next thing to kind of look at is I'm having to check my notes. My notes are on a different screen. Is looking at the update frequency. So an app might have been a really cool app 10 years ago, but it hasn't been updated in 10 years. And so you can see here that this app was updated this month, October 5th, 2021. And you can see also the number of versions they have. So this has had 51 different versions of this app. So it means that they're updating it rather regularly. And so that's a good sign because you don't want to subscribe to a health app that doesn't update, or you don't want to install a health app that doesn't update as needed for the latest health information. And then another thing to look at is things related to privacy. The developer almost always has a privacy policy, so you can look at it, and you can even see that they have a city and address, so you can see this is a real company. And so I can go to the privacy policy, and I can look this up, and I can see, okay, and then you even have last updated in August. So this is a few months ago. That's not too old, and they talk about exactly, what information they're taking from you, why they are taking it from you. And they say that, okay, they do share the health information with specific, carefully vetted researchers to advance female health studies. And then you can learn more by clicking that link. They'll talk about that. And so you can read all of that. And that's kind of nice that they kind of walk through that in a sort of more summarized version because legal policies, as you can see, are quite long and quite intimidating to read all of that. So they do have the nice little summary, the TLDR, the too long didn't read.
Maggie, before you go on, they also mention that they de-identify the
Yes.
information, so which is encouraging because at least then it's not identifying you as a specific individual as a user of the app.
Yeah, so yes, for that purpose, we de-identify your personal data by removing or hashing personal identifiers so that neither the researchers nor any third parties can link it to you. So I didn't read that second sentence, but it's a very important one to read. Good, yes. So obviously, your different patrons will have different sort of tolerances for how much privacy they want to retain. So as the library, we can just simply point people to these pieces of information and allow people to make their own judgments about what they're comfortable with and what they're not comfortable with. So I think it's just helpful because, I mean, until I literally took a webinar teaching me about this. I would have never gone because who scrolls all the way past all the crazy reviews? Like that's so much stuff to scroll through. It's a long page. So the fact that that you're, that you have to go all the way to the bottom like this to even kind of see these things, it's important. The last thing that I also highly recommend people check is the permissions. So this is basically the app permissions. When the app is installed, it asks to be able to do certain things on your phone. And so basically for this phone, and you'll be surprised at all the permissions. So this phone basically asks to sort of the uniqueness of this device. So when they say identity, they don't mean like your identity isn't like your social security number. They mean like, do you already have the app installed on your phone? And what version of the app do you have? That's kind of what they mean, is being able to figure that out. Or if you're, for example, if you pay for the premium version of the app, they want to give you they want to know that it's you so that you can log in and get all that access to the premium content. And then basically storage. So when they say read the contents of this USB storage, they modify or delete the contents of your USB storage, i.e. they want to be able to store files on your phone because you're going to be logging health information. And so they need access to your files to do that. And then again, the contacts, you're like, why does it need access to my contacts? Well, apparently they need that to find accounts on the device. If you're not comfortable with that, then maybe don't download that app. Again, photo media files, it's again, this idea of storage. And then they're going to be able to, they need to be able to connect to the Wi-Fi to transmit data for such reason. Then they have the other suggestion, which is it wants permission to control vibration, receive data from the internet, read sync settings, view network connections, all of these different things. And you're like, this is just an app where all I'm doing is inputting like data about my period. Why would I need this? Why would it need all these controls? And so it's an important thing to realize when you're setting up these kinds of apps. And then you'll see that it says like updates to Clue Period and Cycle Tracker may automatically add additional capabilities within each group, i.e. if you download and update the latest version of the app, it might ask for more permissions. Now, there was a recent law that was passed that basically said that when new permissions are needed, the apps have to tell you that. They can't just suddenly give themselves more permissions without asking you. So that's a new feature. So that's why if you ever get a pop-up that suddenly says like, we need permission for us to do this. And you're like, why are you suddenly asking me this? It's because an update has required new permissions and they're legally required to like ask you about that. They have to get your consent. So this is just one example with one app, but this is the kind of thing that librarians can do to sort of help support. And this doesn't have to be health related. This could be for any app. This could be just part of a mobile apps workshop that your library provides. But when it comes to health stuff, there's maybe additional concerns related to things like privacy and consent that people maybe are more concerned about. So health apps are a really good example. So I'm going to go back to my...
Actually, Maggie, before you leave this page, if you could scroll to the bottom again, where they had their support email. Is it a good idea to click that to see if it's actually going to go or if it points to another email?
Yes. Yeah. So thankfully, since Google Play and Apple iStore are Apple, the iPhone store or whatever the iOS is, they're the ones that put this information on these profiles. So the links are the links. You won't get like dangerous links. So you can feel free to click anything. You don't have to worry about clicking anything because this page is managed by Google Play and not by the app developer themselves. So for example, when it says support at helloclue.com, it really is that link. But unfortunately, you don't really know anything other than that's the link. So if I click on it, it'll automatically do this. I'll show you. This is what it showed. I'll just show you my screen so you can see it. It popped up because I have my at Microsoft Outlook. It started an email saying support at helloclue.com. So you really can't get much more information than that. But it is, an option. Definitely by looking at like, okay, so it looks like Hello Clue really, that's their website. So they've got an email server associated with this website. So maybe I should check out this website and see, can I get actually other contact information through their website? So like maybe I can find somebody and get some kind of additional assistance that way. Maybe I can go to their FAQ and I can figure out like, is there a contact form that's not just a random support email? So that's kind of another option. Because even the legitimate apps will have very generic emails like that, which aren't exactly comforting. Which, but that's just because it's simple and easy to remember. And so it makes sense that they would have that. Like we have a email for getting help at my library that's just like HSCL reference at ufl.edu. It's just very generic. That's because it's a shared email account that all the librarians check, so it's always challenging. But so you feel free to click on any of the links here because this is not the developer's website. It is Google Play's website. And so it won't be like spammy or virusy. That's the whole point of it being. And that would be another thing that libraries and librarians can recommend to patrons, which is definitely only get your health apps through official app downloading stores like Google Play or the iOS the Apple version of Google Play, because Google and Apple have done some vetting to make sure that these apps aren't just malware. Whereas if you download the app just off of the wilds of the internet, there's not that same vetting that takes place. So that's why, it's a good recommendation librarians can give to patrons when it comes to looking for apps is staying in the stores. There's a little bit of safety there because Google could be held liable if one of the apps in their available through their store was malware and was like a virus or something like that. So that's a good thing to know. But very important. And that's, again, important whether it's health related or not, but the concerns are suddenly a lot higher stakes when it's health related. So checking my time. Okay, I'm still good. I've got a few more minutes, but I can do it. So yes, things to check: app developer, update frequency, privacy policy, app permissions. This is very kind of standard thing for figuring out how health and technology can be, how to guide your patrons through health and technology mobile apps. So next on, social media. We have a lot of feelings about social media, don't we? So many feelings. It's going to be great. So I'm going to take this, I'm going to do YouTube and I'm going to do Facebook. I'm not going to do Twitter because Twitter is kind of it's a little bit different because of the character limit. Makes it harder to share. I don't know. It's a different sphere. Whereas a lot of YouTube and Facebook are the ones that are kind of the biggest challenges for when it comes to health information and health misinformation. So I'm going to start with the good, which is the good and the bad, which is YouTube. So I personally, and this is definitely not an opinion that everyone has, but I personally think that videos and documentaries are inherently problematic as formats because they don't allow the viewer much control of the way that they engage with health information. So for example, if you were reading a blog post or a written article, you could skip around. You could real quick check the references and you can you can read the article out of order. You can't watch a video out of order. You're just sort of much more passive in the way that you consume video content. So as a result, I'm generally very skeptical of any information that is shared through video, but that is my personal opinion and you don't need to share it. But what I will say is YouTube as a platform, or I should maybe say Google by proxy, since Google is the one that owns the platform, has done some really good work to try and reduce the amount of health misinformation that is on their platforms. And they've done so through this partnership with the National Academy of Medicine. So I've just included two links, sort of from the two perspectives. One is I'm just making sure I'm still sharing the right thing. Okay, good. One is YouTube's official sort of announcement about it. And then the other is actually the grounding, the science and the evidence. So back in, I want to say March, basically YouTube said, hey, National Academy of Medicine, can you convene a group of fancy scientists and experts to, we will commission you to come up and figure out principles for defining and verifying the authority of online providers of health information. And they had a big public webinar. I went to it. It was really cool. They had all these experts sort of sharing ideas and you could provide feedback. And they actually wrote a discussion paper, which you can access through that second link, the nam.edu link, where they go through the processes of figuring out, okay, how do we decide whether or not what counts as authoritative when it comes to health information? So they have this wonderful document. It's really cool. And YouTube used that document as the basis for, and this is what I'm going to have to show you by going to the internet. Sorry, I'm always juggling between many things, but that basically, if you're from an accredited hospital, university, a government account, if you basically are verified in that way, your videos will have a little note at the bottom that says, this is a trustworthy source of information, or that this video was made by an accredited hospital. So I'm going to get you a little example. Actually, I might even just use the YouTube blog because it kind of demonstrates it the easiest. So I'm going to just go to the blog post that kind of explains this. I'm going to zoom in because it's always too small. So you'll now see, you can see the screenshot on the left. There's this type 1 diabetes video, Diabetes Basics, and it was from the Cleveland Clinic. And you'll see that there's this little blue thing that says from an accredited hospital. And in fact, I'm going to see if I can try to actually just go to YouTube and find that video. So let's do that real quick. Diabetes Whoops, hi there. Basics, Cleveland Clinic. So now if I go to Diabetes Basics, and I'm not going to let the video play, but you can see underneath it, there's this from an accredited hospital tag. And that is a cool now tag. And it says, learn how experts define health sources in a journal of the National Academy of Medicine. And actually, if you click on it, you can see this is how they're different health source types. So they have educational institutions, specifically schools of medicine, nursing, public health, dentistry, and pharmacy. And then they have to be accredited using one of the standard accreditation. So different health colleges have different ways of accrediting. So for example, the Commission for Education and Nursing, which is CCNE, the UF College of Nursing is currently getting reaccredited there. And then they have, let me zoom, I know it's super tiny. Doop, doop, doop. They have health organizations, so hospitals, ambulatory care providers, and home-based care providers, and they have to be accredited through one of the standard bodies that allows these health organizations to exist. They also have public health departments. So if you're an official public health department, you can get that fancy tag, a medical journal, government organization. And so they have all sorts of little rules for what those and this is just the first step. YouTube hasn't done any more, but they're planning on doing more. But this is the first step, is basically adding these little tags to these videos to basically let people know this is a good source. Good job, you, for finding this source. And so that can kind of be a sign. So they're starting sort of with a simple route of like, I tag the good stuff. but they're also doing some work that is not as transparent yet. We don't quite know what the background of it is, but they are working on getting rid of misinformation. So this kind of metadata is pretty handy, and the fact that they're transparent about exactly who gets the tags of trustworthiness and why, I think is a really good sign. And so I would say that you can educate your patrons to really look for these tags when they're looking at health videos, because while I personally think health videos are terrible, and let me go back to this slideshow. Oh, hold on. Was I not even in the, did I share the wrong thing the whole time? I apologize. So yes, this is where I was at. So on the YouTube official blog, you can see that underneath the diabetes basic video, there's this from an accredited hospital. And then if you go to get health info, if you actually click, go to this video. So this is the diabetes video that's in their little example. You can see this from an accredited hospital underneath. And then you can actually click through. And when you click through, you can see there are steps for who gets to be allowed to get these fancy tags. My apologies. I did not realize I had not switched to my share. And so you can see this is a very good sort of transparent process for applying sort of, it's like a badge, basically. It's literally a badge because it's a cute little shield with a health plus sign on it. And so that's a way that you can direct your patrons to more trustworthy content. But yes, Mary Kate, were you mentioning?
No, actually, I didn't.
Okay.
No, but that's nice.
Yes. Yeah. So I definitely would check out all these kinds of things. And if you're really curious, I would definitely recommend looking at this discussion paper and learning more about it, because it really provides the science behind how they decided what would be the criteria for this is a trustworthy source. And so I would definitely teach your patrons to be on the lookout for these little badges and try to use those. So, sorry.
Well, and the videos support literacy because there are times where, reading may not be the individual's primary learning mechanism. So this way, by having a video and also pictures, that it would be very helpful.
Yeah, so that is the reason why, despite the fact that I personally abhor videos as a tool of learning, mainly because I think they're very manipulative in their very nature, I also recognize that they are very accessible for folks with limited literacy, and therefore I have to accept their existence. Maggie's personal opinions. So yes, although you'll notice that this video still has an ad, because even though Cleveland Clinic is a trustworthy source, they still monetize their videos. So whether or not a source is monetized, i.e. whether it has ads, does not influence whether or not it gets the nice tag. So the fact that Cleveland Clinic is making money from me watching this video, and then this is actually a weight loss ad. So it's an ad called nomoorebloat.com is like is the website that's being advertised here. And so that's, a little undercuts the value of this video. So I would definitely also recommend that if your patrons are wanting to access health videos, send them to resources that don't monetize. So that would be any government resource doesn't monetize, and then nonprofits generally don't monetize as well. So I would just warn people about that. Okay, back to the PowerPoint. I know I'm switching off back and forth, and I've got to hurry because I'm running out of time. So Facebook has some good things. Facebook, you'll notice. So for example, this is an example post on the right-hand side from my local county, Alachua County. It basically was sharing some statistics related to COVID vaccination. And Facebook has underneath it this little tag, similar to the YouTube one, that says, visit the COVID-19 Information Center for vaccine resources. And you'll notice here on the left that if you actually go to the vaccine or to the COVID-19 Information Resource Center, it has some nice links. So for example, it has on the right, it has examples of different pages on Facebook that I could follow. So the U.S. Department of Health and Human Services, the National Institute for Occupational Safety and Health, the Florida Department of Health. These are all trustworthy, and they've got the little blue check mark of validity sort of pages that I could follow to find more trustworthy health information. And then on the left, it has these nice little tips related to emotional health. And so then you'd think, oh, that's so great. You know, it's trying to provide health information. Well, there's some talk about that. And so I don't know if you guys have seen in the news recently, basically there was a whistleblower at Facebook who shared all of their shared a lot of internal documents and files with the Wall Street Journal. And they have this investigation where there is, and this has been a long kind of understanding that researchers who are trying to understand the mental health or health impacts of Facebook in particular have had a doozy of a time. Basically, Facebook is not very transparent with its information. I know I should share the links to what I am linking on this page. Sorry, give me one more second. Oh, so many links. So this is the Wall Street Journal investigation. And so it's been known for a long time that it is really hard to study Facebook as a researcher because Facebook doesn't want you to, and they will not let you get access to the data. In fact, even just basic data about what you would consider your own like sort of page or profile on Facebook is actually very difficult to get. And so the Wall Street Journal alleges in this big investigation that Facebook is aware that they're actually making the mental health of their users worse. And that there was some specific investigations about COVID-19 information, and then as well as teen girls and mental health, specifically related to Instagram. So I highly recommend that if you want to learn more about some of the troubling things that we've been seeing in the recent news about what Facebook has been doing, you can look at that Wall Street Journal article and decide for yourself if you even want to like point your patrons to Facebook related resources. The screenshot on the left so this is me literally just typing in the word vaccine in Facebook's search bar. So I personally don't use the search feature in Facebook very much, but I thought it was troubling that when I typed in vaccine, I got vaccine mandate news, vaccine side effect news, vaccine side effects, vaccine discussion. You know, it's very interesting to see the kind of information, the auto-filled options that come up when you're typing in. And so that influences obviously what people choose. If somebody searches for vaccine side effects, you're more likely to get some folks who are maybe sharing misinformation and things like that. So I would definitely sort of just be wary. So while Facebook is trying some basic ideas of like, go to the Vaccine Information Center. The Vaccine Information Center really doesn't actually have any information on it. It just points you to trustworthy accounts, which if you're the kind of patron who doesn't trust government accounts in the first place, I don't think you're going to be following the National Institutes of Health on Facebook anytime soon. So it's kind of a challenge there. So just be aware. Unfortunately, there are okay mechanisms for reporting misinformation on Facebook, but there's also a lot of manipulation and sort of bad actors who use the reporting mechanisms on Facebook to actually hide good information. So it's a real challenge. So Facebook is I would say if you're going to have users who are accessing health information, if you have patrons who are looking for health information and social media is a way that they do it, honestly, YouTube is the better bet these days, despite my hatred of videos. So that's just a thing to know. So finally, with what little time I have left, because of course I always take longer than I think, let's talk about patient portals. So this is my last link that I'm sharing in the slides. There it goes. So patient portals can be very helpful tools by which patients can more directly interact with their doctors. So I have personal stories about this. So this is my UF Health. I have a patient portal with UF Health. That's the system, the healthcare provider that I use. My doctor is affiliated with UF Health. And so this is literally a screenshot of my patient portal. And it can be a very helpful tool get contact and get cared by, or to get care from your provider faster. So for example, I had a health issue and I was like, I was waiting. I was like, it's the weekend. I'm going to call on Monday because I don't want to, it's not that urgent, but I would really like to make an appointment to be seen by my doctor. So I call the scheduler line to try and make an appointment, and I am put on hold for half an hour. Now, I luckily have the kind of job where I can just leave the phone on hold for half an hour and just work on my computer while I do that. But not everyone has that privilege. I finally get connected to the doctor, or not to the doctor, to the scheduler. And they say, oh, well, the first appointment available is in November. And then I'm just like, yeah, that's too far away. I'm patient, but I can't wait that long. I need to be seen. And so they're like, okay, well, we'll have a nurse call you in a couple of hours. So I wait a couple of hours. They don't call. They finally call maybe 4 hours later. And it's not a nurse. It's another scheduler. It's just the scheduler at the specific clinic that I usually go to. And they say, oh, well, we don't have anything available until November. Go to an urgent care. And at this point, I'm a little cranky. So I use the My UF Health portal to send a message to my doctor because I can. I send, I send pictures of the health issue. I have a description of the onset of symptoms and what I have been doing. And then lo and behold, 45 minutes later, I get a call from that same scheduler who was very cranky at me because I went over her head and I messaged the doctor. And she says, oh, well, it looks like, your doctor got your message and she thinks you need to be seen. And then magically an appointment opens up that week for me to be able to be seen by the doctor. So sometimes when there's a lot of bureaucracy when it comes to healthcare systems, being able to connect directly to your care provider by messaging them through these kinds of systems can be very helpful. Now, I will say it does take a bit of tech literacy because these portals are kind of challenging to navigate. Now, if you have a patron who's like willing who is struggling to navigate their health portals, there could be a lot of different reasons. They might not remember their passwords because these are official healthcare portals. There's a lot of security measures. There's going to be two-factor authentication where you log in and then it sends a code to your email. And then I have to copy and paste that code into the login in order to be able to access my health portal because they're really concerned about making sure that that your information isn't hacked. So this is where basic, like sort of tech literacy skills, like using a password manager and remembering your logins and bookmarking common links so that you know exactly where to go. These are the kinds of skills that will help patients. So while you probably don't want to see patients' personal healthcare portals, that's kind of more information than you would need to know as a librarian, by offering basic skills in remembering passwords, keeping track of passwords, bookmarking common websites so that you remember that, because that's often usually the biggest barrier is the fact that, I can't remember how to get to my patient portal, or I can't remember my login. And so teaching your patrons how to use a password manager or how to use a bookmarking system can be very helpful in kind of helping them navigate and organize all of this because they can be very complicated. And then the one on the right, I just want to say, because I know I'm running out of time, that's the Florida Health Connect patient portal. So this is where it also can get complicated is if your patron is seen by many different health systems, each one of them has their own health portal. Florida Health Connect patient portal is if you're seen by the Department of Health. My UF Health is actually uses MyChart, which is done by the Epic electronic healthcare system. So thankfully, because Epic is such a big company, I actually have my pharmacy, CVS. I have a patient portal through CVS, and it's connected to my patient portal through UF Health because they're both run by MyChart, which is the company that runs this little patient portal software. So that's kind of helpful, but otherwise, that's not always the case. And so that might also be confusing, which is, again, why it's not our job as librarians to like get into everyone's health business, but teaching them basic things about managing passwords, like bookmarking websites so that they can remember where to log in, all of that kind of stuff is really, really key. So, okay, sorry. I know I went as late as I could wait. I was like, I'll be done in 45 minutes. There could be lots of time for questions. Well, that was a pipe dream. I just get talking, man. I just start chatting. Any questions, comments, things about Anything I said, I know. You're at this point, you're just like, I'm done.
Maggie, this is Mary Kate. So as we wait, so getting people to, because my first thought is, well, especially, my parents are slightly older. If they were going in and, they needed to contact the doctor, they're so used to picking up the phone, calling the office, that sometimes emailing through the portal is faster. By introducing other activities where they access a portal and then click to email, that's a good way to provide that learning, and it becomes more habit.
Yeah.
So
yeah, making it a normal thing. I'm going to stop my share so I can see everyone's shining faces. Hi. Yeah, so making it a more normal activity of like messaging people. So even if you can introduce them to a typical, like, this is how you message, or even going through with them, like if you have a family member who's got this issue, or if you have a patron who's just willing to have you sit next to them and you can walk them through it, it's navigating the menus does take a little bit. Thankfully, MyChart does have some videos, which I will share. MyChart's a really common one. So let me see if I can find those. Patient portal. Some nice tutorials. So I will share their little, the Epic, which is the company that runs MyChart, is one of the biggest healthcare information managers out there. So and honestly, it's a lot like programming a DVR or a VCR. If you learn one system, you kind of know them all. So I would agree that like Mary Kate says, if you get them into the habit, or if you teach them one system for doing that kind of thing, you'll learn they'll be able to kind of get the basic way of like, oh, here's the button to message my doctor. So I would definitely recommend that. And again, this is like all up to what the willingness of your patron is. If you're not interested in sitting next to a patron as they navigate their own health portal, because that feels like an invasion of privacy, you don't have to do that. But you can at least teach them basic tips for navigating health and navigating the internet, navigating Zoom for telemedicine, which I didn't even really get a chance to talk about, which is, like the basics of video conferencing. How do you do a video call? How do you mute yourself? How to unmute? All of those basic skills are incredibly important when it comes to things like telemedicine and patient portals.
I'm wondering if Epic or Cerner is another major.
Yes, Cerner is another one. Yeah.
If you within your community, if you can reach out to hospitals to see if they do training, because I wonder if they would be willing to come in and say, hey, we have a practice chart. Let's go through the steps of doing this, this, and this, because that might be more productive than, librarians trying to set up, practice pages.
Yes, exactly. Yeah. It's easiest if you have a test person, like a John Doe that you can work with. And I would have definitely imagined. So unfortunately, UF Health, doesn't really have a patient education department, which I will always forever want to. It's just such a joy in my life. But many hospitals actually do have like a patient education or a family resource center or something like that. So I would definitely recommend contacting and talking to the people who manage the health information system for your hospital system, because they very well would have like a test, or they might be able to get directly in contact with the vendor themselves, with Cerner or with Epic, and they are always happy to provide some kind of tutorial or demo of the patient portal. So definitely something you can reach out to your local healthcare system and bring someone in to demonstrate what it's like to navigate these portals without having to go into your patron's personal health portal, which does not feel like a comfortable activity for anybody.
Nope.
So any other questions, thoughts? I'm just here ready to chat.
Oh, I was going to ask one, several years ago, as far as literacy levels and stress, if someone's receiving a new diagnosis, how does that impact their ability to comprehend and process information?
Yeah, so I didn't go over this in the very brief review, but that's a big thing. It's really easy to think of, oh, well, limited literacy people. That's a subset. Those are other, it's very easy to other those kinds of folks as, oh, well, those are just people who aren't very educated. But in reality, when you're in times of high stress, they've actually shown that your health literacy plummets. So you'll have like master's degree educated people who, know what's going on, but then the minute they get the cancer diagnosis or something very stressful like that, their ability to like critically analyze information and make make good, thoughtful, reasoned decisions just like sinks. And that's why like a lot of times when they first give that diagnosis, they won't even bother telling you anything because they know that you need time to process. Because if they give you a bunch, it's almost like if you've ever had a dental procedure and you're coming out from under anesthesia, and they give you a bunch of like the aftercare instructions after your dental procedure. Do you remember anything they say? No, you were totally like high on the crazy happy gas. You do not remember anything. I never remember anything they tell me, even though I nod and act like I totally get what they're saying. I just have to read the instructions later and be like, oh yeah, that's what they were saying. It's the same thing. When you're under that it's like you're under the influence of anesthesia. You're not taking in any new information at that moment. So this is why it's really important not to like stigmatize and say like, oh, well, yes, it's always that like, low educated kind of person who like has limited health literacy. I have this really like compelling video about this woman who is like this author and world traveler and all sorts of things. But her literacy was very, very low because of like this whole like malnutrition situation when she was younger. And so while she like appeared like this very, with it, got it kind of lady, she just didn't understand anything. So she actually ended up consenting to a medical procedure that she had no idea what was happening because she just wasn't, she didn't want to admit that she couldn't understand. So definitely not, like when it comes to health literacy, situational context is really important. And we definitely don't judge our books by a cover, but we don't judge books by their covers. Patient education.
Yeah, this is an interesting question.
Yeah. So, like I know from the provider perspective, but I'm trying to think of how patients, because, so if you've ever heard of like a pain checklist or like a pain questionnaire, they ask questions like, is it burning, throbbing? Is it radiating? There's like all these different adjectives they use to describe different kinds of pain. So those are common in like, pain inventories, which is like a survey that they'll send that they'll ask patients to describe their pain, because whether your pain is like throbbing versus burning is actually like can help with the diagnosis, which is kind of cool. But that's very much from the provider's perspective, like those instruments and questionnaires. I don't know about specifically things related to patients describing symptoms. There are definitely some symptom checkers and things online of various validity. But I think the questions they ask can be helpful in sort of helping patients think about exactly what their symptoms are. So that is another option. I would say questionnaires are often like little walkthrough questionnaires are often the best resource.
And we can actually follow up with you, Diane, and send a link later because there may be some resources we can identify that might be able to provide some resources.
Yeah. So for example, Mayo Clinic has a symptom checker, and Mayo Clinic I actually trust because if you've ever, have you ever Googled something and there's like information, Google the health thing and information pops up on the right-hand corner and it's like trustworthy health information, like us away from the regular Google search results. They actually get that information from the Mayo Clinic, which is why I trust them. Or rather why I recommend them. So for example, Mayo Clinic has a symptom checker that if you look, for example, this, and I'll actually just share my screen so you can see it. Give me 1 second. Share screen. You can actually see it. And this is what I'm talking about with like the questionnaires is like, is the cough dry, producing phlegm or sputum? Is it triggered or worsened by allergens or is it accompanied by So these kinds of questions, and so like this symptom checker, there's so many more. So if you go, let me see if I can go back into, hold on. They have all different kinds of symptom checkers. Oh, don't do that. Sorry, hold on. I broke the site. There you go. They have all different kinds, and it will get into that specific, like, you know, aspects. So pain is intense, mild to moderate, moderate to severe, stabbing or burning, throbbing, pressure or squeezing sensation, pain is located. So this kind of thing. These can be very helpful. I wouldn't really ignore about the, like, I would ignore maybe the causes, because like that, we don't diagnose people. That's not our job. But the questionnaires themselves can be really, really helpful in helping navigate that kind of, what are the different attributes and aspects of symptoms? Because yeah, you're right. It's like really challenging to like how to describe your symptoms unless you are getting, because if you're just asked, can you describe how you're feeling? I'm like, I'm feeling bad right now. I have no other ability to say anything else. Whereas if you have a checklist, you can say, okay, I can check yes, this, no, that, yes, this, no, that. And that's really much more accessible. So I would recommend using something like that, but ignoring the like, here's your diagnosis part, because that part, that's not our job. That's not what we do. But the checklists themselves are helpful. So sorry, I'm going way over time. We're just chatting.
But Diane, thank you for asking. That's a very good question. That's a great question. And it's something you might check. Sometimes the institution, Maggie, I'm not sure if UF Health has a symptom checker. Sometimes hospitals will actually have that available on their website. You know, so if the individual is comfortable with their healthcare provider, they might.
Yeah, and what the advantage of the advantage of using the one for your local healthcare system is that they'll often have like connect to a provider who specializes in this thing. Mm-hmm. So there's a really direct connect to care. Whereas if you use a generic, not a generic one, but more of a national one like the Mayo Clinic, like you're not driving to Jacksonville to go to the Mayo Clinic, you know. That's, your patient doesn't have time for that, or your patron doesn't have time.
Especially if you're in South Florida.
Yeah, exactly.
Yeah, it's such a specialty, you know, there could be.
I mean, people drive long distances to get healthcare, man. It's crazy.
Yeah. So, but you can check the organization's site and see if they may have a that would be available. Any other questions? Any comments?
Well, I hope that you've enjoyed this. I've hoped you've learned something. And then as always, you can check out the recording if in case in all of my blathering, you forgot one of my tips or tricks. You're always welcome to check that out. But thank you again for coming.
And Maggie, you'll share your slides with us so that we can, so Vicki can send them out to the attendees. Okay.
Yes, I will share my slides.
And those links will be within the slides, right?
Yes, they are all in the slides. I just always like to put them in the chat because it's always annoying when it's like, why is she sharing slides when I can't even get them? So yes.
Okay. Well, thank you so much. And again, if after the session, if you have any questions, please reach out to Vicki at TBLC or the official organization, and we'll be glad to follow up with you and provide additional information. Maggie, thanks so much for volunteering to present, and everyone have a wonderful afternoon.
Bye, guys.
Take care.